Welcome to the another session of podcast, which is the voice of D Genius by D Genius Group. As we are all aware, D Genius is a dynamic and dedicated wing of Diabetes India, led by our esteemed Dr. Atul Goklani, under the guidance of our mentor, Dr. Bansi Sabu sir, which consists of passionate doctors under the age of 40. This vibrant group serves as a platform for young healthcare professionals to collaborate, learn, make difference in the field of diabetes care. Today, the topic of podcast is going to be a very interesting topic. We have one of those vibrant speakers from our country, Dr. Amit Kumar Dey. Also, I can call him the AI man in the field of medicine from our own country, India. Dr. Amit Kumar Dey is a distinguished consultant physician specialized in diabetology, obesity, and metabolic disorders with 13 years of clinical experience. He is based in Kolkata. He has been awarded several awards like ACP Award, JPF 2023 Awards, Indian Chapter Governor Recognition Award. He is also certified in the American Board of Artificial Intelligence in Medicine. He is a fellow of Royal Society of Public Health, United Kingdom, and Diabetes India, and a key advisory member of the ACP India chapter. Dr. Amit Dey is the founder chair of Doctors AI, a medical community connecting over 2,000 healthcare professionals on AI-related topics. He serves as an associate editor at JMIR Diabetes and as a faculty member at the National Diabetes Education Program. He has extensive publications and in peer-reviewed journals. He is also the host of widely acclaimed podcast series AI, Decoding AI in Healthcare, which has reached a global audience in over 60 countries. Dr. Day recently hosted the Dr. AI Virtual Global Summit 2024, which was a huge success and a landmark event with 100 plus speakers from 15 countries, where 1,000 plus delegates participated globally. And the topic of our podcast is technology and artificial intelligence in GDM. Hello, Dr. Amit. Can you hear me? Hello.
Hi, Hitesh, and a big thank you to Team D Genius for this invitation and for keeping this exciting topic on the podcast.
Let's start. As we are aware, GDM percentage is increasing in India day by day. It's around 10 to 35%, but the exact percentage is not known. Dr. Amit, just tell me, how can AI assist in the early detection of GDM?
So, the first thing that we need to understand, Hitesh, is why are we talking about artificial intelligence, not just in gestational diabetes per se, but in healthcare overall? And the simple reason is what we understand about any disease, and especially a disease like gestational diabetes, through the evidences and the literature that we have, is just the tip of the iceberg. With the advent and with the development of artificial intelligence, we are looking at a lot of data, and the data giving you a lot of information. And from that information, you can derive intelligence. And as a result of that, for the first time, possibly in the history of medical science, we will be able to see something which lies in the whole of the iceberg, something which is even beneath what meets the eye. So, for the first time, we will be able to visualize more than what we have been able to see with the help of data, information, and intelligence. And as a result, in this field of gestational diabetes, we have evidences. But how far the evidences are actually helping us in predicting the outcome of the gestational period and the outcome in the fetus and the mother, this is where artificial intelligence can come in. So, if I can broadly classify and give you an understanding, Hitesh, that the conventional artificial intelligence tools, which is not new, which has been there for many years. And when I talk about that, I mean the machine learning and the deep learning algorithms. These algorithms, if they're applied as in the format of statistical uh, data analytics to a larger set of data, then they will be able to give you a very good prediction model in predicting the outcome of uh, the diabetes during the gestation period in both the mother and the fetus. And it is just a start. We've had this this practice of looking at large prospective longitudinal data and then predicting the outcome. You just want to do that in a more advanced and in a more augmented way with the help of artificial intelligence. So that is a start, the research part and the prediction. And that's where it all starts with in the field of GTM. Hitesh.
When you say that AI has always been there, okay, could you please specify some examples or some models which were used before the advent of recent AI boom in the market in the healthcare?
Yes. So as I said, the research aspect of gestational diabetes can be largely covered with the application of something called machine learning. And machine learning, in simple term, is allowing the computer or the technology to pick up a pattern which the human eye would not be able to pick up very easily. And using the algorithms, it will give you a prediction based on the pattern that it picks up. And this has been there for many years. This has been in evolution since the last 10 to 15 years. There's another layer of machine learning, which we call as deep learning. And it means looking at these patterns, just like the neural networks in our brain would look at it. And it is mostly used for images, especially in the field of radiology. But when you are looking at a specific subset of data in gestational diabetes, especially where the diagnostic criterias sometimes are very ambiguous and there are multiple criterias which are available, and as a clinician sometimes we're also very confused as to which one you're supposed to go for, in specifics to the region where you're practicing. And also in gestational diabetes we see that the diagnosis is often late because of lack of preconception counseling. The connect with the doctor, the connect with the healthcare provider, whether it's the obstetrician or whether it's the diabetologist, is often delayed because of various socioeconomic and various other logistic challenges. In such case, if you can have a predictive model that can really give you a prediction, it will go a long way in helping both the healthcare provider as well as the patient identify the need and then address the challenges as we go forward. So, what I was talking about is in the field of predicting the early outcomes of gestational diabetes, machine learning tools are very, very useful. And if I can give you some of the examples, there are a lot of reviews from the literature as we speak, which talks about the use of explainable artificial intelligence using the machine learning algorithms like support vector mechanism or an SG boost or a gradient boost algorithm to give you certain predictions using the clinical and the laboratory markers. As I say this, these are not very complex thing to do. We have all been trained in our medical school days to work with statistics and biostatistics, and that is conventional statistics as you call about. You can just add a layer of artificial intelligence analytics to these biostatistics to give you these algorithms will help you understand the data and the pattern that comes out of it in a better way. So, as I said, the XGBoost has been published in certain papers, which is a type of machine learning algorithm, and it outperformed the traditional statistical analysis of a logistic regression by uh, with about 87% accuracy. And there are many such examples from a meta-analysis study that looks at machine learning prediction can be actually going a long way in predicting the onset as well as the outcome of gestational diabetes. Having said that, I will always say these are very early days. We are just looking at a very early set of raw data and whether it can predict or not. So now when you have a larger prospective set of data collected in different demographic areas, and then you have that analyzed with machine learning, I'm sure we will be able to pick up much more nuanced pattern of the progression of the GDM and the outcome in the fetus and the mother. Hitesh.
Oh, that's great. It's always good to learn all this terminology related to AI from you. Now, for our young doctors, I would ask what specific AI tools and models we have currently that can be used to manage GDM or are under development. If you could shed light on that.
So What I just spoke to you about is the conventional artificial intelligence, the machine learning and the deep learning models. This would find its application more in the research area. So a clinician like our DGenius member might ask me that what's in it for me? I mean, I am a practicing doctor seeing 40 patients in a day, and I often get patients with gestational diabetes or diabetes in pregnancy coming to me, late onset diagnosis, and coming up with a very bad hyperglycemic spikes and dysglycemia HbA1c of 8 and 10, and then we have to control them irrespective of what the outcomes might be. So how can I really enhance my practice with the use of artificial intelligence tools? So there comes the concept of the newer forms of artificial intelligence which are now available with us, and hence the hype. And when I say this, I am talking about generative artificial intelligence. So what do you mean by generative artificial intelligence? From the name you understand that it is a type of AI that can generate content. So you're looking at generating text, audio, or video from an instruction which you're giving to the technology or to the computer. And this process of giving the instruction and it generating the output is actually called natural language processing. Now, imagine a setting where you have a patient, and with the help of the technology, the patient is connected to you even beyond your clinic visit hours. The patient is connected to your electronic medical record through the cloud. The patient is connected to you through an app, and the patient's continuous glucose monitoring data, as well as the glucometer readings, are constantly being fed to you through the connected device that you're connected with. This will empower not just the patient, but also the clinician to have a better insight on the entire 9 months of journey of the patient beyond the clinic visits. This is what generative AI can actually augment. So, beyond the use of this technology of connected care, which we often give to our patients with the help of the connected glucometers and the continuous glucose monitorings which are available now, that gets you connected over a cloud, and you also have the electronic health records which are interconnected with the apps. If you can add a layer of generative artificial intelligence to it, you're actually giving a virtual health assistant to the patient even beyond when the patient is not in connect with the doctor. This will inform the patient with the right advice at the right point of time. And this is based on the, the scientific concept of just in time adaptive intervention, which means that if you are delivering the right advice to the patient at the right point of time, then the outcome is definitely going to be much better in terms of the clinical results that you will get in the patient. Now, derive that in the context of gestational diabetes. You have a mother who has been diagnosed with diabetes during the pregnancy, still not able to cope up with the lifestyle, with the diet, with the 3 times a day insulin uh, pricks, at the same time with possibly 4 times or 6 times a day blood sugar monitoring. Imagine empowering this kind of a patient with a generative AI chatbot or a virtual health assistant, which can talk to the patient in their own language, in multiple regional language, using natural language processing, in not just supporting the patient through all the diabetes distress and the mental health support that the mother would need during the pregnancy, but also giving nuanced advices and guidance under the supervision of the clinician in continuous process. This is what generative AI can actually empower not just the patient, but also the clinician in understanding and closing that need gap which we need to deliver during the management of gestational diabetes. We always talk about connected care, Hitesh. But when we talk about connected care, we are always driven by devices. We don't look
Right.
at the use of natural language processing that can really connect the patient with the clinician, because that will empower the patient to pick up a good sort of information which is readily available, but at the same time, it has to be the right information being available to the patient. So that's where the connect with the doctor comes in, so that the doctor can monitor what advice is being delivered by the Gen AI chatbot to the patient. And I think this opens up a whole new arena in which we will be practicing medicine, whether you're an obstetrician, a diabetologist, or in any other specialty. This will kind of just enable connected care with the patient, and I'm sure it will improve the outcome on a large scale in GDM and in all the diseases. Hitesh.
That's great. For the listeners who don't know Amit, he is already having a chatbot, Madhu AI, and you can get more info about it if you go through the net. And it's one of those chatbots which has been validated by the doctors, and it can help. He can also shed light on this later on. Okay, Amit, I wanted to ask, what are the challenges or risks do you see in adopting AI tools in clinical practice for GDM? That is also one of the major things that our doctors ask, like, is it safe? Am I not going to be sued if something happens wrong to my patient? So if you could shed light on that particular part.
Yes, I think the first challenge is the challenge that happens of the integration of AI into healthcare, that is literacy and education. And when I say literacy, it means the literacy for both the healthcare provider as well as the end user. In this case, is the patient, if you're talking about a generative AI tool to be used by the patient. So the literacy is the biggest challenge. The second challenge is the data on which the tools are being developed. So the integration and the data is is very, very important. The third challenge is the application through the means of a validated and an evaluated tool. And I think this is a process in build. This is something that we are trying to do, that not just any Gen AI chatbots can be introduced into the market unless it's validated and evaluated by the clinical fraternity or by the experts in the field. In this case, if you're looking at a Gen AI chatbot which is going to be guiding patients on GDM advice or on hyperglycemia and pregnancy advice, then it has to be validated and evaluated by diabetologist, endocrinologist, obstetrician, and physicians across a particular spectrum. So this is how these are the challenges that need to be overcome. But having said that, Hitesh, challenges are just a start, because the sky is the limit of improvising. Uh, I would say personalized care, especially in the field of gestational diabetes, because the beauty of GDM care is you get 9 months to control the patient, and it's a time driven control that you need to do. Time is of essence when you're managing a patient in those 9 months. So every second, every minute counts. So if you are able to have a methodology by which you're able to connect with the patient through a validated, evaluated response, having all the education and all the literacy at both the ends, then I think a lot of those problems can be solved. But these challenges are just the start. More challenges will come up: regulation, guidelines, privacy, etc. And I'm sure as we go along evolving with the use of AI and technology, we will keep on solving these challenges as well.
Thank you, Amit. But you didn't talk about the risks associated with the AI in adopting for GDM clinical practice. Could you shed light on risks also? Like, what are the risks a young physician can face while adopting AI and the ethical consideration along with this?
Yeah. So one risk of adoption of artificial intelligence is that when you look at the use of generative AI, it is generating content, right? So there is always a risk of automation bias. What I mean to say by that is that the individual will be driven by the AI driven response. So your cognition somehow gets dampened, and you kind of go with the AI response more with your individual response. So the lack of cognitive skills or the loss of cognitive skills, there is a big risk there, and this is where the human wisdom needs to overpower the the AI or the artificial intelligence, I would say, and then use it in the form of an augmented intelligence. So you have the AI advice, the AI guidance giving you, and you add your intuition, your clinical knowledge, and your wisdom on top of that, and you use it with a more informed decision to decide a clinical outcome for the patient, especially when you're trying to manage gestational diabetes. The ethical aspect, I think I just touched upon in the last part of my previous answer, was that I think it's the privacy. It's the privacy which makes a lot of buzz around in the AI and healthcare world. Is that uh, imagine giving a chatbot to a patient, and the patient is discussing with the chatbot. So there has to be a privacy, there has to be a data encryption, there has to be a data privacy there. And also, the regulations and the guidelines as to how much of the advice the chatbot should be helping the patient on. So all this are still a gray line. And I'm sure, as I said in the last answer as well, that as we evolve with artificial intelligence, we will be seeing more and more of these clouds going away and more clearer picture as to how effectively we can implement these generative AI tools and the natural language processing into the clinical practice. The other aspect I also want to highlight about, besides the use of a chatbot, is the concept of clinical decision support system. Now, this brings in your connected devices, your connected care, it brings in a chatbot, it brings in the electronic health record, it brings in the an app through which the patient can be connected with you. And this whole thing kind of closes a loop of connected care with the patient as the end user at one end and the healthcare provider at the other end, and technology integrating this whole cycle. And this is very much needed in gestational diabetes care. And this is where I feel that an application, we've seen applications of FDA approved clinical decision support system in which have been FDA approved for type 1 and type 2 diabetes care, but I'm very sure that you can find application even in gestational diabetes care. More so with the advent of connected glucometers and with the use of connected glucose monitors, like continuous glucose monitoring devices. Hitesh?
Yeah, that's great. Yeah, I wanted to ask, like, you presented this particular presentation in PSG 2024, which was held at Aurangabad. And like when we
Yes.
talk about the GDM diagnosis, before we used to be like very particular, like we have to wait till second trimester or the beginning of second trimester, this month, that month. But in previous PSG meeting also we have discussed like we have to be rational and we have to start diagnosing the GDM cases earlier. There are some theories, but that's not guidelines right now. Like 8 to 10 weeks, we can start doing GDM screening. And then when this time we were lucky to hear Dr. Yagnik, with whom you also discussed his 30 years data on how this GDM start much before in the womb itself. So like what is the how can AI help to have the conclusion from that 30 years of data by such a clinical researcher like Dr. Yagni? Could you shed a light on this?
Yes. So this is where the power of pattern recognition algorithm comes in, Hitesh. And this is why I say that we have spent years and ages on our conventional statistical methodology to derive an outcome and a predictive outcome, expected predictive outcome from a prospective study, like a 30 years data, as you're talking about, a longitudinal data. This is where machine learning comes in. This is where generative adversarial network comes in, which kind of adds a super layer of synthetic data. Now, you have a smaller set of data, and you are expecting, you're trying to get an amplified result with a better sensitivity and a specificity, but you do not have that huge subset of data or that enough time to carry on the data. So this is where the GANs and the generative adversarial networks and the addition of synthetic data used ethically and effectively, of course, can kind of give you a better picture and an earlier picture of that pattern, especially in terms of the clinical outcome, or as you said, the prediction whether this child is going to develop diabetes after delivery or not. Those kinds of patterns can be picked up using these machine learning algorithms. And how does it do? Well, it just connects the dots, just like, our human mind is trained to connect the dots. Just try to imagine when we were taught medicine in our younger days, all we did was connecting the dots. The way you diagnose a patient with your differentials and your provisional diagnosis is that you learn from the textbooks and then you connect the dots and then you reach a diagnosis. An AI tool does just the same thing, but in a much more deeper and extensive way, such that the dot that it connects may be much beyond the comprehension or the visual acuity, if I can call it, of a human brain. This is where it makes it more powerful. So, in a shorter span of time, with a lot of synergy, you can actually connect multiple dots, augment that data with synthetic data, generative adversarial networks, and get a much more amplified result, let's say, of a 30-year prospective study with significant accuracy. that can predict the outcome of the disease. And especially taking the words of Dr. Yagnik and also the legendary Dr. Seshaya, that GDM is the mother of all the diseases, of all metabolic diseases. It starts in the womb. So what if we are looking at a prevention which is much earlier than primordial prevention? We are talking about primordial prevention, but what if with an algorithm, you can pick up that subset of individuals who are having a very, very high risk based on the pattern of the demographic pattern and their lifestyle pattern, their family history pattern, their genetic and epigenetic pattern. And you can predict that this person has a risk of developing gestational diabetes even before they probably have conceived or in the very early days that they have conceived. These are not impossible. With pattern recognition algorithm, with a larger set of data, this is possible to be done. And the more and the beauty of it is, Hitesh, the more we feed the data, the more accurate these algorithms will be getting in predicting. So the sensitivity and the specificity and the outcome of the prediction outcome is going to be very accurate to what is expected, uh, to the conventional ways of analytics. So this is, I think, going to be the future in which we will be doing medical research, just not gestational diabetes research. And as a result, we will be getting a lot of predictive outcomes from the statistical analysis using artificial intelligence in gestational diabetes. This will find a very profound place because we want to diagnose them early on and give them that lifestyle advice, the medication advice, and etc., and the preconception counseling or the early conception counseling, so that they don't develop into an overt clinical diabetes during the gestation period and end up with all the complications. So I think AI can actually fit in beautifully in this space, in this predictive outcomes.
Okay, I wanted to ask, like, just imagine a young doctor comes to you. He's naive about AI, all the technology that's going on in this world. What advice would you give to healthcare providers considering AI tools for GTM management at present era, without talking about all the models, that predictive model that's gonna come in future? So at this present, someone comes shows to your clinic and asks, "Sir, what to do with AI in today management of GDM?" So what is your advice for that? A practical
Well,
advice, a
for
simple
yeah,
practical.
so you're right. So for the day-to-day management of gestational diabetes, I think uh, AI will come in somewhere. But for the first thing is the the clinician will have to have an electronic health record system, and preferably an EHR that is integrated to the cloud and that has a connected app which they can enable the patient to use. So the connectivity is most important. Now, of course, what we are working on is integrating Madhu AI, which is a generative AI chatbot on WhatsApp, using a large language model through these connected devices. So now you can add the layer of generative AI to the to the app which the patient is using and to the electronic health record which the doctor is using, which can get both of them connected in a very simplified and user friendly manner. But the start has to be with getting yourself connected to the patient with the use of technology, with your electronic medical records and your app. And the second is to make sure that you are documenting as much as possible the continuous glucose data of the patient. Because remember, data is intelligence. And from continuous glucose monitoring, we have learned that overview of this graphs makes us much more intelligent in understanding the condition of the patient. So from data to information to intelligence, and then you can have an enabler. AI is an enabler. So you can have an enabler layer which can help you understand the data better. So you could use an AI tool that can help you understand the continuous glucose monitoring graph, something which we have showed you folks can be done using a custom chat GPT. You could use Madhu AI. We are even training Madhu AI to give an understanding about carbohydrate carb counting, insulin dosing, and also give an understanding of continuous glucose monitoring graph. So all these enablers are definitely going to be there, which will be assisting. But to start with, a clinician needs to start with the tech at home. They say charity begins at home. I say technology begins at home. So they need to start with the technology in their clinic. They need to have an electronic health record. They need to have the app connected to the patient. And if you have the connection, if you have the data, you can use the AI enabler, interpret the data in a more intelligent way. And more tools are going to come up that's going to make life easier for us as we go along.
Yeah, that's great. That's what I always believe. Like, uh, gone are the days when we have to wait for patient to come to our clinics for next visit, like 15 days or 1 month apart. Nowadays, it's a every minute monitoring is important, and that's what make a difference.
So the
Great
most
session.
important thing, Hitesh, is just before you close, and I just want to say this, that the healthcare, especially gestational diabetes care, is one segment where we have to be patient centric, because every patient is different, every mother is different, every individual will have a different glycemic pattern, and every individual will have a different obstetric outcome. So, keeping that in mind, with all the limitations and all the factors, we will have to give them very, very personalized care in a time specific manner, because you're talking about those 9 months of intensive monitoring and care. This is a space where you can really say, and I really mean this, it's not like the doctor will see the patient now. It's like the patient will see the doctors now. So there's a big difference. As a
Exactly.
doctor, I will have to reach out to the patient for the better care rather than the patient coming to me in my busy OPD seeking the care. But for me to reach out to the patient with the right care, I need the data to give me an intelligent advice as to how and when I should reach out to the patient with the right kind of advice. That's what AI is going to enable us to do.
That's great. Just last thing, just give one solid tip for our young doctors which can be applied. AI and healthcare. Just one tip.
Yeah. So I say there are four pillars of starting with AI. Get yourself familiar with the foundation knowledge of AI. That's what we do at Doctors AI. Start understanding the nuances of how these tools are working and how it is producing the output. So I say go from the wow factor to the how factor. Get yourself familiar a little with the algorithms that works behind the scenes, although we need not be technocrats to understand them, but we need to have some basic bilingual understanding about the technology, the way it works. The third is the most important step, and that is identify the need gap in your practice that you feel can be solved by artificial intelligence, because you are the driver, you're the pilot, you are in the ground zero, you're working there, you can identify this problem, no one else. And the fourth is find a collaborator in the tech world that can help you understand the need and give you an AI solution for that need. I think these four steps is how a doctor should get started with artificial intelligence in healthcare and beyond. Thank you very much.
Thank you, Amit. Thank you, Amit. Again, anybody who want to learn about AI, there are a lot of opportunities coming in 2025. First of all, we have our Diabetes India meeting at Ahmedabad, which is from 13 to 16 February. You can also register for fellowship. And there is the DTech Con, which is coming in Jaipur. I think it's in March. And it's always great to listen to Dr. Amit and his AI adventures and hope to see much more in this field of it. Thank you, Amit.
Thank you. Thank you for the invitation.